Well, a former top doctor is calling for more research into COVID jabs after experiencing a vaccine injury.
Your former member for Wentworth, Dr. Karen Phelps, suffered irregular blood pressure and breathlessness following her second jab. I'm pleased to say she joins us live. Dr. Phelps, good morning. You and your wife both suffered vaccine injuries. Can you take us through what happened?
Yes, good morning, Charles. Hello, Christine. Well, in Jackie's case, we obviously did a lot of homework about the vaccines and went along to have the vaccines done because we believed that on the balance of risks and benefits that was the best thing to do. And within minutes of having the vaccine, she had a quite severe reaction with numbness of her hands and feet, tingling all over her body, her head feeling like it was going to explode, pain, and then over the weeks and months following that, the condition continued, and she'd seen a number of specialists, and the conclusion was that she had had an injury related to the vaccine. And so that was in her case. I went back and had the second vaccine, thinking that, you know, it's a rare reaction, and again, on the balance of risks and benefits, and in my case, I developed a reaction where my blood pressure, my pulse rate, and my temperature was going up and down all over the place, and with some quite distressing symptoms and persisting for quite some time, and over a period of many months. And I was diagnosed with a vaccine-related dysautonomia. So, you know, over the process of the last year and a half or so, I've also spoken to a number of colleagues who've had vaccine adverse events themselves, patients who've had vaccine adverse events. And so when I was putting in the submission to the long COVID and reinfection inquiry for the Australian Parliament just in the last month or so, I included the group of people who have suffered adverse events from vaccination as a group that needs to have special consideration when it comes to prevention of long COVID.
These are serious side effects. Why did the medical regulator, AHPRA, warn doctors then, as you claim, not to speak out about these vaccine side effects?
Well, you'd have to ask AHPRA themselves about their motivation, but certainly quite a number of doctors that I've spoken to have felt impeded in speaking out about their concerns about vaccine adverse events because of the statement made by AHPRA that doctors shouldn't say anything that was going to impede the government's vaccine rollout. And they took that to mean not to publicly raise their concerns. Now, I think it's important to say that when we're talking about a massive pandemic with a high rate of deaths and hospitalisation, that there has to always be, with any immunisation program, a balance of risks and benefits of what we are trying to achieve in terms of reducing deaths and hospitalisations, balanced against the fact that with any medication, any vaccine, there are going to be some people who have adverse events. But I think it's very important with this new vaccine, it's only been around for less than 2 years, that it's time that we put some research funding and some real effort into looking at the causes for the vaccine adverse events that people are experiencing. And they're experiencing a whole range of different types of vaccine events. They're experiencing things like cardiovascular events with myocarditis, pericarditis, and that's not just confined to young males. It's I've spoken to middle-aged female doctors who've had this effect. It's people who have rheumatological side effects, so they have musculoskeletal and joint pain. I've spoken to people who've had cardiological side effects. It's a whole range of different groups of people who've had neurological side effects, for example. So we're looking at immune system problems with people with reactivation of autoimmune disease. So with this large spectrum of side effects, we're also seeing a very large range of side effects of people with long COVID. And so there are some crossovers in people with the adverse effects from the vaccine and long COVID, quite similar symptoms in many. So there could be some common factors there, which needs research, needs funding, and needs a big effort.
Dr. Phelps, we appreciate your time this morning.
Thank you.
Authorised G. Rennick, LNP Chermside.